You are given a pathological report showing protein, cocci, and polymononuclear cell. What is the diagnosis? It is chronic osteomyelitis. What do you think the cause is? It is due to infected implant, and common organism Staphylococcus aureus. Organism infected implant, common organism Staphylococcus aureus. How path is formed or pathogenesis? First, microbial invasion, then acute inflammation, vascular congestion, then increase permeability of the vessel and exudation of the fluid, and infiltration of the polymononuclear cell, and that is the pathogenesis of pus formation. Why pus burst through the bone? Why pus burst through the bone? Due to increase. Why pus burst through the bone? Why pus burst through the bone? Due to increase interosseous pressure, due to increase osmolarity.
So this is remarkable. A paper tablet created for people who like to take notes. It even feels.
Due to increase interosseous pressure, due to increase osmolarity, which occur due to tissue breakdown. Due to increase interosseous pressure, due to increase interosseous pressure, due to increase osmolarity, due to increase interosseous pressure. Okay, why pus burst through the bone? Due to increased interosseous pressure, due to increased osmolarity, which occur due to tissue breakdown, due to formation of the large rounded local opening in the involucrum. Okay, due to formation of large. Due to increased interosseous pressure, due to increase interosseous pressure, due to increase osmolarity, due to increase interosseous pressure, due to increase osmolarity, which occurs due to tissue breakdown, due to increase interosseous pressure, due to increase osmolarity, due to increased interosseous pressure, and due to increased osmolarity, which occurs in tissue breakdown. Okay, why pus comes out through the bone? Due to increased interosseous pressure and due to increased osmolarity, which occurs and due to tissue breakdown, and the formation of large cloacal opening, due to formation of large cloacal opening in the involucrum, due to formation of the large opening, due to formation of the large rounded cloacal opening, due to formation of the large cloacal opening, and formation of the large rounded cloacal opening in the involucrum. Why squamous cell carcinoma developed? Sequence of events. Due to chronic irritation. Okay, in the bone, squamous cell carcinoma due to chronic irritation and hyperplasia, which undergoes dysplasia, carcinoma in situ, then carcinoma. Due to chronic irritation, there is hyperplasia, and then dysplasia and carcinoma. Due to chronic irritation, there is hyperplasia, HDC. It is HDC. Due to chronic irritation, there is hyperplasia, which will turn into dysplasia, and which means carcinoma in situ, and then formation of the carcinoma. Due to chronic irritation by the implant, there is due to chronic irritation, there is hyperplasia, then it turns into dysplasia or carcinoma in situ, and then from there it develops carcinoma. Due to chronic irritation, there is due to chronic irritation, due to chronic irritation there is hyperplasia. Due to chronic irritation there is a hyperplasia which turn into dysplasia, which is carcinoma in situ, and then turn into carcinoma. Other name of the dysplasia is carcinoma in situ. Other name of dysplasia is carcinoma in situ. Other name of carcinoma in situ dysplasia. Name of protein deposit in osteomyelitis amyloid AA. Name the protein deposit in osteomyelitis amyloid AA. Amyloid AA. In chronic osteomyelitis amyloid AA. In acute osteomyelitis CRP. Okay. In acute osteomyelitis it is CRP, and in chronic osteomyelitis it is amyloid AA. In acute osteomyelitis CRP. In chronic osteomyelitis it is amyloid AA. Specific pathological name for pass specific pathological name for pass around the screw or implant plate biofilm. Specific pathological name of the pass around the screw, it is biofilm. Biofilm can be asked defined biofilm. Pass around the implant. Pass around the implant. Pass around the implant. Pass around the biofilm. Biofilm is the pass. Biofilm is the pass around the implant. Biofilm. Biofilm is the pass around the implant. Biofilm is the pass around the implant. Biofilm. Biofilm. What is biofilm? Pass around the implant. Pass around the implant. Biofilm. Pass around the implant is called biofilm. Pass around the implant is pass around the implant is called biofilm. Define the sequestrum and involucrum. Sequestrum is the dead bone. Sequestrum is the dead bone that has become separated during the process of necrosis from normal bone. Sequestrum is the dead bone. Sequestrum is the dead bone. Sequestrum is the dead bone that has been separated. Sequestrum is the dead bone that has been separated. Sequestrum and involucrum. Sequestrum is the dead bone that has been separated from the bone during the process of necrosis. Sequestrum is the dead bone that has become separated during the process of necrosis from normal bone. Sequestrum is the dead 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 bone that has been separated. Sequestrum is the dead bone that has been separated. Sequestrum is the dead bone that has been separated from the bone during the process of necrosis. Sequestrum is the dead bone that has been separated during the process of necrosis from the normal bone. It is a complication. It is a complication of the osteomyelitis. It is a complication. It is a complication of the osteomyelitis. And involucrum, reactive oven or lamellar bone deposition forming a shell of living tissue around a sequestrum. Sequestrum is a dead bone which has been separated from the bone during the process of necrosis, and it is the complication of chronic osteomyelitis. And involucrum, this is a woven or lamellar bone. It is a woven or lamellar bone deposition. This is sequestrum. This is sequestrum, and it was the normal bone. It has been separated during the process, and around it there is woven or lamellar bone formation of woven or lamellar bone. This is involucrum. So this is a woven or lamellar bone. This is woven or lamellar bone deposition forming a shell of living tissue, forming a shell of living tissue around the forming a shell around the sequestrum. Okay. Involucrum is a woven or lamellar bone deposition. Involucrum is a lamellar or woven bone deposition around sequestrum. Uh, woven or lamellar bone deposition forming a shell around the sequestrum. Type of crystal in gout and pseudogout. Type of crystal in gout and pseudogout. In gout, monosodium urate, and pseudogout, calcium pyrophosphate. Pseudogout, big name, so big deposition. Pseudogout, calcium pyrophosphate. Types of crystal in gout and pseudogout. Crystal in gout is monosodium urate. Monosodium urate type of crystal in gout. Monosodium urate. Monosodium urate in gout. Monosodium urate in gout. In gout it is monosodium urate. In gout 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 it is the monosodium urate, and in pseudogout calcium pyrophosphate. In gout monosodium urate. In gout monosodium urate. In pseudogout calcium pyrophosphate. In gout monosodium urate. 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 In pseudogout calcium pyrophosphate. In gout monosodium urate. In gout monosodium urate. In gout monosodium urate. In gout monosodium urate. In pseudogout calcium pyrophosphate. In gout monosodium urate. In calcium in gout monosodium urate. In gout monosodium urate. In gout monosodium urate. And in gout monosodium urate, and in pseudogout calcium pyrophosphate. Types of amyloid deposition: amyloid AA, amyloid AL, and beta amyloid. Amyloid AA, amyloid AA, amyloid AL, and beta amyloid. Beta amyloid, hereditary. Okay. Why amyloid cannot be removed from the body? Amyloid are very hard to break down because of their stability and ordered structure. This is one. Amyloid fibers are very hard to break down. Amyloids are very hard to break down because of their orderly structure and stability. Amyloid are very hard to break down because of their structure and because of their stability. Amyloid are harder to break down because of their stability. Amyloid are harder to break down. Amyloid are harder to break down because of their amyloid are harder to break down. Thank you. Amyloids are very harder to break down. Amyloids are very harder to break down because amyloid are very harder to break down because of their stability and ordered structure. Amyloid are harder to break down. Amyloids are harder to break down because of their amyloids are harder to break down because of their stability and ordered structure. Also, the body has no specific. Also, the human body. Also, the human body has no specific protease enzyme to break down it. Human body has no specific enzyme to break down it. Human body has no specific enzyme to break down it, and amyloid cannot be secreted by the kidney. First of all, amyloid is very hard to break down because of its stability and ordered structure. Human body cannot, kidney cannot excrete by the kidney, and human body has no specific enzyme to break down it. Human body amyloid are very hard to break down. Amyloid are very hard to break down. Amyloid, first of all, amyloid is very hard to break down because of its stability and ordered structure. Human body has no protease enzyme to break down it, and as it is not breakdown, it is remaining as a whole. So amyloid cannot be secreted by the kidney. Extra, what intraoperative measures to reduce the risk of osteomyelitis? Avoid prolonged starvation, avoid prolonged starvation, avoid prolonged starvation, good preparation of the patient, antibiotics, and using aseptic technique. Laminar flow in the theater, laminar flow in the theater. First of all, what intraoperative measures to reduce the osteomyelitis? Um, Use aseptic using aseptic technique, using aseptic technique, use laminar flow in the theater, proper antibiotic coverage, and a good preparation of the patient, and avoid prolonged starvation. First of all, um, using aseptic technique, using aseptic technique, avoid prolonged starvation. Sorry, using aseptic technique, laminar flow in the theater, using aseptic technique, laminar flow in the theater, using aseptic technique, laminar flow in the theater, proper antibiotic, good preparation of the patient, and avoid prolonged starvation. Why rheumatoid arthritis patient susceptible to osteomyelitis? Rheumatoid arthritis patient susceptible to osteomyelitis because of rheumatoid arthritis patient use some immunocompromised. Okay. Mm, hmm. Rheumatoid arthritis patient susceptible to develop osteomyelitis, immunocompromised, taking immunocompressive drugs or steroids. Rheumatoid arthritis patients are susceptible to osteomyelitis because of use of steroids or compromised by taking immunosuppressive drugs, using immunosuppressive drugs. Or even drugs or on steroids. What to do in OR after removing implant? Good debridement and take swab for culture and sensitivity. Good debridement and take swab for culture and sensitivity. This is pathological fracture patient, but I would like to go for quick revision of this. Hey Krishna. Revision in 3 minutes. Okay, male patient presented with a left knee swelling and redness with a history of tibial fracture and internal fixation. What is the single bedside investigation? Knee aspiration of the fluid. What we look for color, amount, viscosity, turbidity. Yes, color, amount, viscosity, and turbidity. And what test we will do? We will do gram staining, culture and sensitivity, micro cytology, chemical analysis, and crystal. Cytology, chemical analysis, and crystal. You are given a pathological report showing protein, cocci, and polymorphonuclear cell. Diagnosis is chronic osteomyelitis. Chronic osteomyelitis. What do you think? Because of infected implant organism, Staphylococcus aureus, how pus is formed? Pus is formed by bacterial invasion, then acute inflammation, uh, acute inflammation, vascular congestion, increased permeability, and fluid extravasate from the vessel, and infiltration of the polymorphonuclear cell. Why pus burst through the bone? Due to increased interosseous pressure, due to increase osmolarity, which occurs due to tissue destruction, and due to formation of cloacal opening. Due to formation of large rounded cloacal opening in the involucrum, due to formation of large rounded cloacal opening, due to formation of the large rounded cloacal opening in the involucrum. Why squamous cell carcinoma? Due to chronic irritation, there is hyperplasia, then dysplasia, which is carcinoma in situ, and then it turn into carcinoma. Other name of the dysplasia is carcinoma in situ. Name of the protein in acute osteomyelitis CRP, and chronic osteomyelitis amyloid AA. Specific pathological name of the pus around the screw of the implant is biofilm. Can answer about the biofilm. Biofilm is the pus around the implant. Sequestrum. Sequestrum is the dead bone which becomes separated during the process of the necrosis from the normal bone, and involucrum is the woven or lamellar bone forming a shell around the sequestrum. In gout monosodium urate and pseudo gout, calcium pyrophosphate. Type of amyloid: amyloid AA, amyloid AL, and beta amyloid. Amyloid cannot be removed because of their it is very hard to break down because of their stability and ordered structure. Human body cannot has no specific protease enzyme to break down it, and amyloid cannot be excreted by the kidney. Interoperative method using aseptic technique. Okay. Laminar flow in the theater, antibiotic, good operation of the good preparation of the patient, and avoid prolonged starvation. Rheumatoid arthritis patient use suppressive drugs or the steroids, so they are more susceptible to osteomyelitis. What to do in or after removing proper debridement, good debridement, and take swab for culture and sensitivity. Next station, number 10. A young female was cycling when she suddenly developed pain in her thigh. As soon as she put her foot on the ground, X-ray showed fractured shaped femur with hypodense shadow. What is the type of this fracture, and what is pathological fracture? Young female was cycling when she suddenly developed pain in her thigh. As soon as she put her foot on the ground, X-ray showed fracture shaped femur with hypodense shadow. What is the type of fracture? This is pathological fracture. Type of fracture? This is pathological fracture. Type of fracture? Pathological fracture. What is pathological fracture? What's pathological fracture? What is the type of fracture? What is the type? This is pathological fracture. And what is pathological fracture? Bone fracture which occurs without adequate trauma and is caused by pre-existent pathological bone lesion. Bone fracture without any adequate trauma, bone fracture which occurs, bone fracture which occurs without adequate trauma, 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 bone fracture which occurs without adequate trauma and is caused by pre-existing pathological bone lesion. Bone fracture which occurs without trauma and is caused by pre-existing bone lesion. Bone fracture which occurs without adequate trauma and is caused by pre-existing pathological bone lesion. What is the cause of pathological fracture? Cause of pathological fracture: neoplastic, non-neoplastic. Pre-existing bone lesion which occurs uh, is caused by pre-existing pathological bone lesion. Pre-existing pathological bone lesion. What are the causes of pathological fracture? Neoplastic, non-neoplastic. Neoplastic, malignant tumor, primary tumor, or metastatic tumor. Malignant tumor, neoplastic by primary bone tumor like multiple myeloma or metastatic bone tumor. Neoplastic primary bone tumor like primary bone tumor like multiple myeloma, and by secondary bone tumor, by metastatic bone tumor, and non-neoplastic is osteoporosis, osteomyelitis, osteomalacia. Osteoporosis, osteomalacia, osteomyelitis. Osteoporosis, osteomyelitis, osteomalacia, osteogenesis imperfecta. 4 non-neoplastic. Non-neoplastic we have O and O, then at last B. So osteoporosis, osteomyelitis, osteomalacia, osteogenesis imperfecta, bone cyst, Paget's disease, bone cyst and Paget's disease, and radiotherapy. Again, osteoporosis, osteomyelitis, osteomalacia, osteogenesis imperfecta, Paget's disease, bone cyst, and radiotherapy. What are the most common primary source of bone metastasis? Thyroid, breast, kidney, prostate. Thyroid, breast, prostate, kidney, and lung. Thyroid, lung, breast, kidney, prostate. Thyroid, lung, thyroid, breast, lung, kidney, and prostate. Most common primary source of bone metastasis. Okay, primary source, it can come primary bone tumor is multiple myeloma, and secondary bone tumor, it may come from the thyroid, breast, lung, kidney, and prostate. What is the name of brain tumor causing sclerotic metastasis? Medulloblastoma. Name of the brain tumor causing sclerotic metastasis is medulloblastoma. It is medulloblastoma. Medulloblastoma. Brain tumor causing bone sclerotic metastasis is Medulloblastoma, sclerotic metastasis, medulloblastoma. Fracture was treated with internal fixation. How to check for malignancy? By bone biopsy. Fracture was treated with internal fixation. How to check for malignancy? By bone biopsy. By doing bone biopsy. fracture was treated by internal fixation. Now how can check the malignancy? By bone scan, by bone biopsy. By bone biopsy, how they can check? By bone biopsy. Pathology report showed a typical pathological report show a typical bland appearance for follicular cell. What is the probable location of the primary? Pathological report show a typical bland appearance. Pathological report show a typical bland appearance of follicular cell. What is the probable follicular cell? It is thyroid gland. Typical bland appearance of follicular cell. What is the probable location? It is thyroid gland. A thyroid nodule was detected and FNA was done. However, it has not been able to rule out or confirm cancer. Why? Follicular thyroid neoplasm malignancy is determined by the capsular and vascular invasion, which need histology rather than a cytology to confirm. Okay, a follicular thyroid neoplasm. mm, a follicular thyroid neoplasm malignancy is determined by the capsular and the vascular invasion. Determined by capsular and vascular invasion. Follicular thyroid neoplasm malignancy. Follicular thyroid neoplasm, the malignancy, follicular thyroid neoplasm malignancy, follicular thyroid neoplasm malignancy is determined by capsular and vascular invasion. Follicular thyroid neoplasm, follicular thyroid neoplasm, follicular thyroid neoplasm, follicular thyroid neoplasm. Follicular thyroid neoplasm malignancy is determined by capsular and vascular invasion. Follicular thyroid neoplasm. Follicular thyroid neoplasm is follicular thyroid neoplasm. Follicular thyroid neoplasm. Follicular thyroid neoplasm. Follicular thyroid neoplasm. Neoplasm malignancy is determined by the capsular and vascular invasion. So which need histology. That's why it was not confirmed by the FNSA, which is actually cytology. Follicular thyroid neoplasm. A thyroid nodule was detected in FNA was done. However, it is not ruled out by the cancer because FNA, FNAC follicular thyroid nodule. A follicular thyroid nodule. It needs histology rather than cytology. That's why it was not detected. It's a need histology rather than cytology. Because we are suspecting follicular thyroid neoplasm. Follicular thyroid neoplasm. This malignancy is determined by the capsular and vascular invasion. Capsular and vascular invasion. Which is determined by the capsular and vascular invasion, which is determined by the capsular and vascular invasion. Which is determined by the no, by the histology, if not by the cytology. What are the other sites of ectopic thyroid tissue other than the head, neck, and mediastinum? Ovaries and testicular teratoma. What are the other sites of ectopic thyroid tissue other than head, neck, and mediastinum? Other than head, neck, and mediastinum, thyroid tissue can be in other than head, neck, and mediastinum, thyroid tissue can be in ovary and testicular teratoma, ovary and testicular teratoma. What investigation can be done to confirm thyroid? What investigation can be done to confirm thyroid metastasis? We can do radioactive iodine scan, radioactive iodine scan. What other investigation can be done to confirm the thyroid metastasis? Radioactive iodine scan, radioactive, we can do radioactive iodine scan, radioactive iodine scan. Which type of thyroid cancer? Which type of thyroid cancer? Which type of thyroid cancer that will show no response to iodine uptake? Medullary thyroid cancer, medullary thyroid cancer, medullary, medullary, medullary thyroid cancer will not, medullary thyroid cancer, cancer as it is the origin from parafollicular C cell. Medullary thyroid cancer as it is originating from parafollicular C cell, and which is not a follicular origin. Medullary thyroid cancer, Hey Krishna, Hey Krishna, Hey Krishna, 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 Krishna. Hey Krishna, Hey Krishna, Hey Krishna, Hey Krishna, Hey Madhav, Hey Krishna, Hey Krishna. What type of thyroid cancer will not show no response to iodine uptake? Medullary thyroid cancer, because it is originating from parafollicular C cell, and it is a not follicular origin. Tumor marker for medullary thyroid cancer, carcinoembryonic antigen, calcitonin, and carcino CEA, calcitonin and CEA, calcitonin and carcinoembryonic antigen CEA. CEA and carcinoembryonic antigen. The patient needed blood transfusion during surgery. What needs to be tested before the transfusion? ABO, RH, ABO grouping, RH typing, ABO and RH typing and cross matching. ABO, RH grouping and cross matching. ABO, RH grouping and cross matching. ABO, RH grouping and cross matching. ABO, RH grouping, cross matching. If the patient's blood group is known, would you still need to cross match? Match? Yes, to determine if the recipient has any preformed antibodies against any antigen on the blood donors. Yes, we need to detect. Yes, to determine either the recipient has any preformed antibodies against any antigen on the donor's blood. What are the complications of incompatible blood transfusion? Acute hemolytic reaction, febrile non-acute hemolytic reaction, delayed hemolytic transfusion, acute hemolytic reaction, delayed hemolytic transfusion reaction, febrile non-hemolytic transfusion reaction, and transfusion-related lung injury. Acute hemolytic, acute hemolytic transfusion reaction, delayed hemolytic transfusion reaction, transfusion-associated lung injury, and febrile non-hemolytic transfusion reaction. Acute hemolytic transfusion reaction, delayed hemolytic transfusion reaction, non-febrile hemolytic, non-hemolytic transfusion reaction, non-hemolytic transfusion reaction, and transfusion-related lung injury. Define hemolysis: rupture or breakdown of RBC and release of their contents, in the cytoplasm into the surrounding fluid. Acute rupture of the red blood cell and release of their cytoplasm in the blood is called hemolysis. Rupture of the red blood cell and release of their contents into the blood and plasma is called hemolysis. End of the station. Hare Krishna. We'll go for a rapid revision very fast. I'll hold. A young female was cycling when she suddenly developed pain in her thigh. As soon as she put her foot on the ground, X-ray showed fracture and the shaft of the femur with hypodense shadow. It is pathological fracture. What is pathological fracture? Fracture of a bone without adequate trauma in a bone with pre-existing pathological lesion. Bone fracture which occurs without any adequate trauma and is caused by pre-existing pathological bone lesion. What are the causes of pathological fracture? Non Neoplastic and non-neoplastic. Neoplastic primary bone tumor like multiple myeloma and secondaries, which can come from the breast, thyroid, lung, kidney, and non-neoplastic reason are osteoporosis, osteomyelitis, osteomalacia, genesis imperfecta, and Paget's disease, and bone cyst, osteogenesis imperfecta. Okay, and Paget's radiotherapy. What are the most common primary site of the bone metastasis? Breast, thyroid, breast, lung, kidney, and prostate. What are the name of brain tumor? Medulloblastoma. Fracture was treated with internal fixation. How to check for the malignancy? By bone scan, bone biopsy, bone biopsy. Malignancy by bone biopsy. Pathology results showed a typical bland appearance, follicular cell. What is the probable location of the primary thyroid gland? A thyroid nodule was detected and FNA was done. However, it has not been able to rule out any confirmed cancer. Why? Because if any follicular follicular thyroid carcinoma, this malignancy may be confirmed by histology, because it invades the capsule and the vascular invasion. It is determined by the capsular follicular thyroid neoplasm. Follicular thyroid neoplasm is determined by the follicular, by the capsular, and the vascular invasion. For that, we need histology, not by the cytology. What are the other sites of the ectopic thyroid tissue other than head, neck, and mediastinum? It could be in the ovary and the testicular teratoma. Which investigation can be done to confirm the thyroid metastasis? Radioactive iodine scan, radioactive iodine scan, radioactive iodine scan. Which type of thyroid cancer will show no response to iodine uptake? Parafollicular C cell originating medullary thyroid cancer, medullary thyroid cancer, because it is originating from parafollicular C cell. Tumor marker for medullary thyroid cancer, medullary thyroid cancer, medullary thyroid cancer. Tumor marker for calcitonin and carcinoembryonic antigen. The patient needed blood transfusion during surgery. What is it? ABO, RH typing, and cross matching. Yes, to determine recipient any preformed antibodies against any antigen on the donor's blood. Acute hemolytic transfusion reaction, chronic hemolytic transfusion reaction, non-hemolytic febrile transfusion reaction, and transfusion-related lung injury, rupture of the red blood cell and release of their cytoplasm into the surrounding blood and plasma is called hemolysis. A known hepatitis C patient suffered a traumatic splenic rupture with massive blood loss. A known hepatitis C patient. Just let me see what is happening here. Okay. दूध बराबर है আপেল খাবা আনারস খাবা
Wondering how much it will cost to open a company in Dubai or anywhere in the UAE? Our easy-to-use cost calculator can provide you with an accurate estimate in just minutes. Simply visit our website, input a few details about your business, and you will instantly receive a comprehensive cost breakdown. Plus, we will email you the results for your records. Don't wait. Explore your potential expenses and plan your business setup in the UAE.
A known hepatitis C patient